So hello and welcome along to Cancer Care West. Today we are marking the start of our month-long programme to raise awareness of bowel cancer. Today, as part of this, we're very lucky to have Dr. Greg Leonard come to speak to us today. And Dr. Greg Leonard is a consultant medical oncologist in University Hospital Galway, and he has a special interest in colorectal cancer. And he's kindly agreed to speak to us today. So thank you very much for talking to us, Dr. Leonard, and you're very welcome.
Hello, Emma, it's a pleasure, thank you.
That's great. So we just have a few questions for you that hopefully, well, I'm sure you're well able to answer, but we'll just get started if that's all right.
Sure,
cool.
Great.
So first off, just what are the signs and symptoms of colorectal and bowel cancer, and what should you do if you notice these?
Okay, so I guess the symptoms are generally split up into the local issues from the bowel itself, and they're the ones that we most commonly see, and then ones if the cancer is hitting other aspects of the body or affecting you in other ways. So I guess the particular ones to watch out for are the bowel. So you could have a change in bowel habit. So is there a change in the frequency? Is there a change in the consistency? Is it irregular? Is there blood? That's particularly a warning sign. Is there a lot of it? And then pain. So these are things that you wouldn't normally get. And I suppose the big issue is if those issues are persistent, if they're not going away, because we all have, good days and bad days from the bowel's point of view, but if they're persistent or if they're getting worse, that's concerning and that needs attention. Now, rarely if the cancer is a bit more advanced, people might have other issues like pains in other areas, or they may have unexplained weight loss. So some people are purposely trying to lose weight, and that's great, but others are losing weight without intention to do that. And that certainly is a warning sign, not just for this cancer, but for other cancers. So I suppose particularly focusing on the bowel habit, pain and blood, and any changes in that, and particularly if it persists and it's getting worse. And if that happens, really need to seek medical attention, and that really is through the GP. Okay.
So GP is the first port of call, and they'll kind of direct you. Yeah.
Absolutely. So the GP will see that person, very expeditiously. They're very skilled in dealing with this. Most of the time, it's nothing, and there are other conditions like anal fissures or hemorrhoids or diverticulitis. So please God, it's something other than cancer, but take it seriously. Let the GP decide that, and if the GP is concerned, he would then refer that person in, usually to a hospital situation, to generally a surgeon or a gastroenterologist, usually to do an endoscopy, a scope test, and that's how people ultimately are usually diagnosed with this type of cancer.
Yeah, and it's not, I know sometimes people are a bit concerned about scopes and things like that, but it's a fairly routine procedure for most doctors to undertake, to do, I'd say.
Absolutely.
Yeah.
So there's only particular doctors that do it. So they're very skilled doctors that are doing it in the first place. They're the only people who are doing it. The likes of me certainly wouldn't be doing it. So you can be reassured that if someone's doing it, they're very experienced in doing it. And then there's a high detection rate in doing that, in finding something. Please God, there would be nothing there, and there's another explanation, but it provides great reassurance.
Yeah, okay.
And the doctors that do these tests when there are symptoms are generally the same types of doctors that are involved in screening programs. So you've heard of screening where they test for the stool, for example, over 60-year-olds, and then again, if there's problems with the stool, if there's blood in the stool, people would be referred for that same test, a colonoscopy.
Yeah, so you'd really encourage people to go for their screening if they're called to.
Absolutely.
Yeah.
There's no question that the sooner we can catch a cancer like this, the better the outcomes. There's no question, the earlier the stage of the cancer, the better the outcomes, and this can be cured. So while we'd love if it didn't happen in the first place, the most important thing is to try and catch it early, and it can be dealt with and cured, and that's the end of it.
Yeah, okay, well that's really good to know. And it kind of brings me on to our next question. So what kind of treatments are available for people who have the unfortunate diagnosis of cancer?
Sure, so I guess once the diagnosis is made of colon cancer or rectal cancer, which is the lower part of the bowel, then usually it's discussed at a meeting in a hospital where a number of different physicians come together to decide what the appropriate treatment is. And ultimately, there's three different types of cancer treatment. There's surgery, which everyone knows is the main treatment, I guess, that removes the cancer and operates on it. There's radium treatment, radiation. That's usually only used for very low cancers called rectal cancers, tumors at the very bottom part of the bowel, and is not done for all cancers. And then what people would sometimes think is chemotherapy, which is what I do, but probably it's more effectively called systemic therapy, because now we don't just have chemotherapy, we've lots of other medicines to use. So I suppose the main treatment and really the main curative approach for colorectal cancer is the surgery. Okay, and surgery is done by surgeons in multiple hospitals. There's a number, obviously, in Galway that can do that. And there's massive advances in the surgical technique. So some people would think as surgery is difficult and you're in hospital for a long time and side effects. That has really improved over the years because the surgery has got much better, much easier for patients. There's even keyhole surgery. So you think of people getting their gallbladders removed by keyhole surgery. That can be done now very commonly for colon cancer. And there's a lot of new advances for other types of techniques whereby the tumor can be removed surgically.
Oh, that's great.
So that's the surgical end of things. The radiation, again, for a select number of patients that might get radiation, again, a lot of new advances in techniques and not only in treating it very efficaciously, but also in reducing the side effects. So that's really good. And then when we talk about my area, which is systemic therapy, there really has been an explosion of different treatments for it. The vast majority of patients with colon cancer would not even need to see me. They would be operated on, and please God, that would be the end of it. They would not need any additional therapy. Yeah. But then there is a proportion of patients who may need some additional therapy. And for some patients, that's chemotherapy, but that can be injection form, it can be tablet form. And then for some people, perhaps with maybe more advanced disease, there are other therapies coming through, like immunotherapy, which gets your own immune system to work stronger and treat the cancer. And that's a spectacular advance for all cancers, but particularly for a select group of colon cancer patients. And then things called biologic or targeted therapies, where we look at the genetics of the cancer, not just the golf ball tumor or polyp or whatever, actually get down into the DNA of the tumor, and we can find genetic changes that can be targeted with certain specific medicines we have. So really, from a systemic therapy point of view, we have chemotherapy, traditional chemo, we have biologic therapies, which is this genetic targeted therapies, and then we have this great advance called immunotherapy. So really a huge amount of different treatment options for patients, but surgery really being the cornerstone for most patients.
Yeah, God, it sounds like there's an awful lot of options for people going through this. As you say, like, no one wants to get the diagnosis, but it's good to know that there are plenty of treatment options out there.
Absolutely, absolutely. And I think really we've not only got so good now at treating colon cancer, a lot of the advances now are treating colon cancer, but saving patients from the toxicity and knowing who needs what treatment. So not everyone needs all those treatments. So that's really good, because we're being much more specific in who gets what and preventing people from having to go through all of these things. And I think some of the real good advances now are coming in prevention and trying to prevent these cancers happening at all. So, for example, there's trials looking at aspirin, for example, in Ireland to try and see, can we stop cancer coming? And then on the other side, in those who are unfortunate enough to have cancer, we're getting better at following up those cancers and detecting recurrences and things. And again, that's looking at some genetic changes in the blood and things. So it's a very exciting field.
Yeah, definitely. No, it's great to know and great to hear. So I suppose moving on a little bit from that, just what would be, I suppose, well, obviously I work as a physio, so I deal a lot with rehab and exercise, and just to ask you what your opinions on the value, I guess, or how you see it as part of the process for your patients going through treatment.
Yeah, so I think it's essential. I think we're really beginning to understand now that it's not just about some of these therapies, surgery, chemo, dealing with the cancer, but it's dealing with the totality of care and looking at the patient in every aspect, really, from a holistic approach. So I think exercise is a huge part to play in that. So exercise will first of all help reduce you get cancer in the first place. It can change the hormonal milieu, it can change the immune system, it can do a lot of things to the body. Reducing weight, for example, that will reduce your risk of getting cancer. If you have cancer, it will help you have better outcomes. So there's a lot of emerging data saying those who are doing regular exercise versus those who don't. Those who do exercise do better. Their cancer outcomes are better, even if they have cancer. And I guess it also helps us get through whatever treatments we're doing. So it helps people feel better. It helps their mental status. It helps their physical well-being, their strength, fatigue. So there's really a huge amount of benefits to exercise. And I think the important thing is that some people feel exercise is for those who don't have cancer, and exercise is operation transformation and getting healthier and better, and that's for sure true, but it actually applies to the cancer patient too. It applies to those who've had cancer and want to now get better. They've been given a second chance to be the best version of themselves, and exercise is part of that. But even those who have cancer, even those who are getting chemotherapy, we know that they can do exercise, and we know that they can also get those benefits from exercise. And obviously you work with a lot of our patients and guide them through what types of exercise they can do, because that is an individual decision for every patient, because certain patients have different needs, certain patients have certain disabilities, so everyone can do exercise, but the prescription may be different for different people. But for sure, I think we're understanding it's an important part of being healthy, but it's an important part of one's cancer treatment.
Yeah, no, I wholeheartedly agree with you. And I think it's worth people knowing that you don't ever have to have exercise before either, because I think a lot of people who come to see me, they can be quite nervous coming to see me. I think they think I'm going to make them do a stress test on a treadmill or something, but like it's not like that. It is, as you say, it's quite personal to the person, and it is for everyone can do it. It's finding their right level, isn't it? And there are so many benefits to it.
I have patients who are seeing you and they're shaming me into doing more. They say they're doing more exercise now than they ever did before. So I think we can all learn from some of these patients.
Yes, they're
tremendous what these people can do. It's just they're fantastic. It's a great attitude, and they're doing everything they can to do the best for themselves and their families.
Yeah, no, it's true. No, you're absolutely right. And that's all music to my ears, obviously. So just, I suppose our last question then is there anything else that you think the people with a diagnosis of cancer can do to improve their quality of life overall? Like, I know we've talked about exercise, but anything else that you think?
Yeah, so again, I guess it's kind of looking at who is a healthy person and getting the best version of that person from their, cardiovascular point of view, from their mental health, from their, everything that isn't cancer, and then the cancer. So I suppose from the cancer perspective, as I say, we have amazing treatments, there's really good outcomes, and I guess it's just to follow, what the guidance is and what those treatments are, and to do that. But then I think, as I said before, we kind of need to look at the totality of the patient. So I don't know if you ever saw that film, Patch Adams, Robin Williams, the comedy. So there's a quote in that: you treat a disease, you win, you lose. You treat a person, I guarantee you will win no matter what the outcome. So I think if you're treating a person, you're not just treating the cancer. Some people can have brilliant cancer outcomes, but maybe they're not well in themselves. This is about wellness and totality of well-being. And I think we need to address all of those issues. So I think if people are struggling maybe from a mental health point of view, they need to reach out, and there's so many resources, including Cancer Care West, etc. If they're having issues with diet, there's lots of different avenues they can go to get advice on that. Some people may have emotional needs, some people may have financial needs, there's lots of things going on. And for sure, exercise is part of that. We want them to be healthy. They've dealt with the cancer. We want them not to have cardiovascular issues. We want them to be, live a good and full life and be well, not just cancer-free, but be well.
Yeah.
And I think it's really to look at all of those things to get the best version of oneself. And there is the ability to achieve that. And it's about reaching out to Cancer Care West, your GP, friends, to seek advice to try and optimize everything.
Yeah. And I think that's especially important at the moment, isn't it? Just with the current situation, like the ongoing pandemic and stuff, that it's important that people do reach out and don't be suffering in silence. There is help out there.
For sure.
Yeah.
For sure.
Yeah.
I think we're doing more exercise though, aren't we, with COVID? I think, people are,
I think so.
not much else we can do.
No.
In the 5K,
Yeah, I think you're right. I think there was a few months where people kind of maybe didn't do so much, but now I think people are doing a bit more. But that's fair enough. I mean, it's all understandable. Well, thank you very much for coming to talk to us today, and that's been very, very helpful. There's such great information in there, and I've learned a lot as well. So this is great. So thanks a million, Dr. Leonard.
Thank you for all your help, and thanks to Cancer Care West for all they do for our patients. So much appreciated.
Thank you. We'll talk to you soon.
Okay, thanks, Emma. Take care.